to Survivorship Simplified. I am one of your hosts, Adrienne Menzies, and today we're diving into a topic that deserves way more conversation: men's health and survivorship. Movember, is all about raising awareness for men's health issues like prostate health, testicular cancer, to mental health and prevention. Today, I am joined by two of our favorite experts who know this topic inside and out, Dr. Joe Mignone and Dr. Todd Robinson. Can you guys introduce yourselves?
Sure. I'm Joe Mignone. I am integrative medicine, medical oncology, and a co-founder here at SurvivorRx.
And I'm Dr. Todd Robinson. I'm a naturopathic doctor, fellow of the American Board of Naturopathic Oncology, and co-formulator at SurvivorRx.
Today, we are breaking down some of the most common and sometimes confusing questions that men have around prostate health, hormones, testosterone, diet, supplements, food, and health screenings. And, as always, this is just going to be a great Q&A session, a real conversation about real health issues. We're going to talk about how men can take charge of their health, what myths are out there that still need to be busted, and practical steps that you can take to feel balanced and strong and confident, especially after cancer treatment. So whether you're in the watch and wait phase of prostate cancer or you're just proactively thinking about long-term health solution, this episode is for you. So, Dr. Todd, Dr. Joe, so glad that we're here today. We want to start with a simple question, but an important question. How can men know what their experience is normal when it comes to prostate health? So an example would be like, how many times at night is getting up too many times to use the bathroom?
I'll take that one. So they say any time you're getting up more than one time a night, you should have it checked, especially on a repeated basis.
Really?
So if you're getting up consistently 2, 3, 4, 5 times a night and it's interrupting your sleep, you should definitely be checked.
Interesting. I did not know that.
Yeah, the only comments I would add to that would be, especially if something is a change for you. I mean, if you've been checked before, you're getting up once or twice a night, that's pretty regular. You've gone into your doctor, there doesn't appear to be anything wrong, and all of a sudden that changes, that's absolutely a time to go get that looked at again. And then the other thing I would say is if you get up with this urge, like you have to go pee, and you get up, you try and pee, and it's really hard to pee, or you can only pee a little bit, that's also another time to go have something taken a look at again.
Interesting. I feel like most men don't know this.
No. And if there's any blood in the urine, blood in the semen, all those are indications to go get checked out.
I know it's just sort of wild to have to say that.
I was thinking, I'm like, yeah, if there's blood coming out, you definitely need to get that checked out.
You'd be surprised how many people blow it off.
Is there self-talk that goes on where it's like, no, I'm okay. It'll resolve, and it goes on for a week, it goes on for a month, it goes on, no, it'll get better.
I had beets 3 months ago. That's why it's rough.
Exactly.
Yeah.
And sometimes it's intermittent. So you may have it today, you may not have it tomorrow, it may come back 2 weeks later.
Yeah.
Still a problem, still get it checked.
Our next question is about PSA. One, I want you guys to explain what that means. And two, how often should men be getting their PSA levels checked? What normal levels look like, and by what age? I think that's just kind of a topic that not a lot of men know about.
Mm-hmm.
So PSA is prostate-specific antigen, made specifically for the prostate. It is first developed to follow prostate cancer, to see whether it's declining, increasing on the stage of the prostate. We use it for screening now, and we used to use it with digital rectal exams. We find that we don't necessarily need a digital rectal exam unless you're highly suspicious for prostate cancer. And that one exam has caused more men not to go to the doctor than anything else ever out there. So they can get a PSA without a digital rectal exam. We break it down by age. Your PSA naturally goes up as you get older. So for someone 50 years old, PSA should be less than 2.5. For someone 60, you can get closer to the PSA of 4 range. The trend is probably more important than even one test. So if you see it going up on a regular basis, you may be more concerned. You can get elevated PSA from having an enlarged prostate, which is common in older men as well, and not be cancer. So like I said, it's only a screening test that leads you to more testing.
Gotcha.
So it has to be interpreted like as an oncologist, it has to be interpreted in the context of the individual. If you say, oh, your PSA has gone up half a point over the last 2 years since you've had this last run, maybe not super concerning. If it's gone up, 200% over the last 3 months, more concerning.
Definitely more concerning.
Okay. What other things? So you mentioned so that enlarged prostate, BPH, benign prostatic hyperplasia, super common in guys as we get older, can cause symptoms that are sort of similar, a little bit of overlap with people who might have emerging prostate cancer, something like that. What other conditions can cause an elevation in PSA?
Prostatitis, inflammation of the prostate, common. Sometimes we'll give a course of antibiotics where you check a PSA, see if it goes back down. So that's probably the most common for a sudden rise in PSA.
So that's like prostatitis, itis, inflammation in the prostate. Okay.
Right.
Okay.
Now remember, for PSA, we're talking starting at 50.
Yeah.
But if you're African American, they tend to start as early as 40. If you have prostate cancer in a family, that increases your chance of prostate cancer. Maybe start at 40 with them. If you have more than one relative with prostate cancer, that will go from double the risk to 5 times the risk. So
Wow.
exponentially higher. And then if you have multiple relatives with prostate cancer, or relatives with breast cancer or ovarian cancer, then you have to worry about the genetic BRCA mutations that can increase the risk.
And prostate cancer, just for the listeners, it's literally just a blood test. So it's not super invasive. It's not super uncomfortable. A little bit of a blood draw. You get the results back pretty quick.
That needs to be a PSA to all men, that about the non-digital rectal exam.
Yep.
And the low invasive blood test.
Mm-hmm.
Because I feel like the whole reason why men don't check these things regularly is the fear.
Yeah, and your family practice doc will tack it on to routine blood work, checking out your CBC or your metabolic panel or whatever. It's easy.
So what lifestyle factors heavily influence prostate inflammation and the BPH?
This is a question I actually want to ask you about, the debate about. So there's this idea that I've heard over and over again, and when I look at the research, I see sort of conflicting evidence. So we're talking lifestyle, exercise, like cycling, somebody who's maybe a serious cycler, or somebody who rides a motorcycle.
Wow.
With the vibration in the prostate area. I know of one gentleman for whom that really was the cause of his rising PSA, but the research to me has been somewhat conflicting. What's your opinion on?
So going back to the proctitis, it's not always inflammation.
Yeah.
You can have physical irritation in the prostate as well. So, it can happen intermittently. If it happens all the time, maybe that's not something you want to do.
Yeah, I was curious about that. Because cycling, I mean, if you're a cyclist, obviously that's really great for your cardiovascular health, et cetera, et cetera. But if you're, I know they make special seats and cutouts and stuff like that, but you can only do so much. So I was just curious if you had seen any cases over the years where somebody's PSA was through the roof, and it was, perhaps a lifestyle habit like that. That was.
Yeah, that's probably more in the primary care realm. By the time they come to me,
By the time they
already
get to you,
diagnosed.
got it.
What other lifestyle factors could, influence that inflammation or the prostatic, is it prostatic hyperplasia?
Yep.
Okay.
Naturopath, that's right up your alley.
Right up my alley, yeah. So I would argue, like, the general things that you think of as being important for good general health are going to be good for your prostate health too. So this is things like making sure you're eating a healthy diet. You really don't want to be doing the sad standard American, although I don't even know if that term still applies, because I don't know of anybody who actually consumes the standard American diet anymore, but that may be just the people that I work with. I don't know. But a healthy diet, lots of fruits, vegetables, fiber, balanced protein intake, lots of exercise, adequate hydration, maintaining healthy body weight, maintaining good metabolic health, make sure your blood sugar is not through the roof. All of those things are going to contribute quite a bit to maintaining your overall prostate health, keeping your inflammation low, potentially reducing risk of BPH or prostate cancer.
And they've shown low-fat diets work best, less meat. Although the interesting part is if you go too low-fat, you actually can't make your testosterone. So now they talk healthy fat rather than low-fat diet.
So we're looking at something like Mediterranean style diet. That's maybe a good base. If carbohydrates aren't your primary focus, then you could do maybe something in a sort of paleo area where it's essentially the Mediterranean base minus things like too much carbohydrates and beans.
Do we want to talk about screening for testicular cancer?
We should, yeah.
I don't even know what that screening is, to be honest.
Well, it's really pediatricians checking the boys to see if they got descended testes. Because if they don't get a descended testes, they're at much higher risk for testicular cancer. Then after that, it's, physical exam that primaries aren't doing. It's men usually find it themselves.
And it's like once you hit the age of, if you're a man and you hit the age of 30, I think it is that right? If you haven't, like testicular cancer is more likely to occur before the age of 30?
Younger age.
Yeah, okay.
Oh, wow. I didn't know that.
Yeah.
Wow, that's crazy.
I mean, it's a huge drop off after 30.
Interesting. Yeah, I mean, I guess you would have to do a self-exam, kind of like women do self-breast exams. I mean, that's how most women find lumps in their own breasts.
It's usually something that's either found by them or a spouse or.
Well, the answer that I will sometimes give clients is the same answer that I give women when they ask about breast self-exam, right? It's like the breast self-exam is something that you should do on a regular basis. And the way that I describe it is you are trying to become familiar with your own breast tissue. Where if you from month to month notice something has significantly changed, you are going to be way more sensitive detecting that change than any physician would, hands down.
Right.
It's the same thing with testicular self-exam. Get to know your testicles. If they change at all, then
or have someone do it for you.
or have them do it for you. Then that's when maybe you do. And you can have that conversation with somebody where it's like, you can literally go to a provider and say, like, right here on my testicle, this is different, this feels weird, this is a firm lump or whatever it is. And you can help them help you if you have that level of awareness.
Well, kind of shifting gears here, I want to talk about nutrition and especially supplements. I feel like there are so many supplements out there targeted towards men, especially men for, testosterone boosting and diets that are out there that are talking about boosting your hormones, especially for older men. So are there specific foods specifically for prostate cancer survivors or men who have been diagnosed with prostate cancer and are in the wait and watch stage that support their prostate health?
Yeah. So when it comes to foods, I think there is a relatively short list of things that I think have really important evidence to suggest that they can be helpful for somebody who's sort of in that watch and wait period. The first would be foods that contain a compound called lycopene. Lycopene is one of the carotenoid compounds. So it's like most folks have heard of beta carotene in carrots. Lycopene is a carotenoid compound that's present in tomatoes, amongst other things. So lycopene is something that if you consume on a regular basis, has been shown to reduce prostate cancer risk in the first place, to slow the rise in PSA after you have received a diagnosis and are kind of in that watch and wait period. And so all that really means is trying to incorporate some lycopene-rich foods into your diet. And the best, most practical way of doing that is to consume tomato products. Tomato products particularly that are cooked in the presence of fat, because lycopene is a fat-soluble compound. It makes the fat makes the lycopene much more bioavailable. So we're talking like pasta sauces and tomato paste and things of that nature. There's a dish, it's sort of regional, so you can make it spicy or savory or whatever, but it's called sofrito. Essentially, it's tomatoes that have been diced up, simmered in olive oil. Usually there's onions and garlic, which is also healthy for the prostate. Usually there's spices in there too. Very, very good. You can make a big batch, store it in the fridge, pop it in the freezer.
Yum.
Very, very good.
Tomato bisque, I guess, too, because it's like basically all the same things and then blended.
Yeah. So tomatoes, they're your friend.
Awesome. What other foods could men eat besides tomatoes that would, really benefit their prostate health, especially someone post-treatment?
Cruciferous vegetables like broccoli. Try to get a guy to eat a lot of broccoli,
Yeah,
but
you gotta smother it in cheese.
really
That's the
good
key.
for you. Really good for you. Broccoli sprouts are probably even better, but that's good. If they like fish, omega-3. If they don't, supplement, anti-inflammatory, which works great on the prostate. Vitamin D.
Vitamin D, definitely.
What about green tea? I've heard the whole green tea phase.
Green tea is actually quite beneficial. So green tea's got this compound in it. It's abbreviated EGCG. That seems to be like one of the prime movers for the benefits of green tea. Although, as in any other plant, there's half a dozen, if not more, other compounds that are really interesting. But yeah, green tea can absolutely help promote a healthy prostate, maybe slow the rise in PSA after diagnosis, that kind of thing. So green tea, highly indicated. One that I love because it's super easy for dudes to do is pomegranate juice. Pomegranate juice, there's been a couple of studies to show like extracts of pomegranate or pomegranate juice itself can also slow the rise in PSA. So that's one where you can, I always try to encourage people to do, I don't know if you've ever done this before, but chia seeds, they get soaked in a juice or a liquid of some kind. They puff up and they make this sort of delicious slurry if it's too thick, kind of, it's really, really good. But that can help because it provides fiber that will blunt the blood sugar rise if you're just drinking straight pomegranate juice. So a couple of tablespoons of chia seeds soaked in 4 to 8 ounces of pomegranate juice that you can drink throughout the course of the day. It's really, really good.
Chia seed pudding is a personal favorite of mine.
Yes.
With some cinnamon. That's the best. So what foods should men limit, especially those with prostate cancer who have had prostate cancer treatment?
They've shown meat, especially high-fat meats.
Oh, no.
Yeah.
No bacon. Oh.
Yeah, no bacon. Has been shown statistically to have worse outcomes.
Yeah.
So that's one thing you should try to avoid. The more veggies, the better. Anything else you specifically tell them to avoid?
Yeah, I mean, not to be a broken record, but too much sugar, absolutely. This sort of adage that I mean, junk food is bad. We all know this, but sugar in particular can be problematic because it kicks off this whole cascade of like inflammatory pathways that we don't want elevated in prostate cancer. It can put you at increased risk for like metabolic syndrome, diabetes, etc. And we really don't want that to happen either in the context of prostate cancer, because the research shows quite clearly men who are metabolically unhealthy, who fall into that category of insulin resistance or type 2 diabetes, they have a higher risk of developing prostate cancer in the first place, and then they have a poorer outcome after diagnosis. So
that's
really, really important.
That's interesting. Even those who are more susceptible to adult onset diabetes because of genetic factor.
Yeah, so it's probably most about your average blood glucose over the day. And so whether that's because of insulin resistance or whether that's because of some sort of pancreatic dysfunction that's not allowing your body to produce insulin, if the glucose is too high, that's going to be problematic from a cancer standpoint.
Interesting. I did not know that. So talking about, diabetes and that metabolic status and processed sugars, especially refined sugars, we're going to actually have another episode on that soon. So stay tuned, listeners, because that's going to be, kind of talking about the myths around the links of sugar and cancer and, the whole non-sugar diet. So be sure to follow our next episodes. Okay, so we talked about the food element. Now I really want to get into the supplements because let's be honest, there are so many, I'm just going to call them gym bros on the internet, on TikTok, on Instagram, talking about supplements. I'm sure some of them are beneficial, but I'm sure that some of them are not beneficial, specifically for men who have gone through prostate cancer. And, I really just want to talk about what supplements should cancer survivors be avoiding. Are there specific blends? Are there specific high performance male enhancement type herbs that men should be avoiding?
I'll leave that to our natural.
Most definitely. This is a big question.
Yeah.
Absolutely. This is one of those things where I think everyone should engage in a conversation with their medical doctor, their naturopathic doctor, their pharmacist. Get as many opinions about this as you can, and don't just trust what the internet says. So there's this persistent myth that supplements are not regulated. They are regulated. The problem is that there's not enough inspection and enforcement. The FDA does not have the bandwidth to catch all the bad actors quickly. So even though the supplement industry is regulated, there's a lot of hijinks that goes on. And one of the areas where that hijinks happens most frequently is sports supplements, supplements that are intended to help you put on muscle or boost your testosterone. Those can be, depending on their ingredients, very problematic for men who have a history of prostate cancer or at high risk for it. Same with libido enhancing supplements. There's a high tendency for them to be literally contaminated with drugs, like what we would consider to be a pharmaceutical drug.
Wow.
So you have to be really, really careful about those sort of classes of supplements. Outside of that, there are definitely some supplements that you wouldn't necessarily expect to be potentially harmful, but absolutely can be. And then there's a whole slew of supplements that can be beneficial. So in that first category, one example that I like to bring up all the time is vitamin D. So in prostate cancer, vitamin D has what we call a J-shaped curve. And that's a technical way of saying when you look at the risk benefit kind of thing, the risk benefit is in a J shape, meaning if your serum vitamin D levels are too low, you're at higher risk of developing prostate cancer, amongst other things. But there's the flip side of that coin too. If your vitamin D levels are too high, you are also at increased risk of developing more aggressive prostate cancer. And so this is a prime example of something that is generally considered safe, where there's a very, very important window in which to keep your serum levels of vitamin D. You're not going to know that unless you're working with somebody who sort of understands that picture, can measure that for you and help keep you within that window.
Yeah, this is a good, kind of segue into the whole multivitamin thing. There's the one a day that, they have for women, men, senior women, senior men. And there's so many things in those proprietary blends that people just have no real insight into. And the dosing could really be problematic specifically for cancer survivors because they shouldn't be getting too much vitamin D, or there could be filler ingredients in there that is not going to support their survivorship. Are there any type of like specific ingredients for prostate cancer survivors that you would say like avoid this supplement?
So, perfect examples, low dose zinc, really good for the prostate. But like most other companies out there, people are like, oh, little, I'll take a lot. Now you're starting to get into problems. So high zinc will start decreasing your copper levels and will actually be detrimental for your prostate. So you have to get things in their therapeutic window.
Right.
And if you don't, you can cause harm. B vitamins, the same thing. One of my patients recently was on multiple different supplements for hair loss, as well as a probiotic that was also B fortified. The hair loss was B fortified, and she was taking a B complex. She developed neuropathy.
Oh my gosh.
And luckily her neurologist looked at her all supplements and realized that she's taken a lot of Bs and did B complex testing, and she was way over, like 1,000 times over therapeutic levels.
Basically overdosing on vitamin B.
Correct.
Wow.
That's one of the real challenges, is because so many supplements are multi-ingredient, and it's really not uncommon for supplement companies to be like, oh, we'll throw a splash of the B vitamins in there, and we'll throw a little bit of this, and then if you're taking 4, 5, 6 different supplements that are multi-ingredient, before you know it, you're taking way, like, unless you sit there and do the math, you don't realize you're taking 10,000% of what you're supposed to get in a day.
Right.
So
Yeah, and even people taking biotin that helped. High dose biotin interferes with a lot of lab tests. If you don't stop at 48 hours before your lab test, you can throw off levels, and people will be making a judgment on what medication they should be putting you on based on wrong levels.
I just had that happen with a client where their thyroid level was unexpectedly completely out of whack. And they're like, I've never had this problem before. I don't understand. And they were just about ready to be put on thyroid medication. But that's when the question came up. It's like, well, you're taking this biotin for a different reason. Did you stop that? And like, no, I didn't know I was supposed to. It's like, okay, well, let's let it clear your system and retest. And sure enough, her levels were normal. So it's that type of simple thing that can actually lead to, important complications for people, because she gets thyroid hormone when she doesn't need it. That's not a good thing.
So, talking about supplements and, lifestyle improvements that men can do to, reduce their risk of prostate cancer or improve their prostate health. or just men's health in general. I know that for a lot of us, especially us Americans, it's, hard to eat a good diet. We drive by Chick-fil-A and we just want that fried chicken sandwich so bad. And, we're not always feeling motivated to go to the gym. So what are practical supplements, specifically ingredients, that men can take to better their health?
Okay, well, one of the things that I always say to men and people in general, dietary changes are probably always going to be better than supplements. And sometimes it's easier to add in than it is to take away. So you can add particular foods into what is overall maybe not the healthiest diet and still get in some of the functional foods that we talked about earlier. So you can have your Chick-fil-A, but make sure that you have your pomegranate juice or your green tea or your whatever it is, as well. But then in terms of supplements, I mean, I think there's some really low-hanging fruit that can be super helpful. Something as simple as making sure your vitamin D is in an optimum range, very important. Joe, I would define vitamin D in an optimum range as being sort of 40 to 60 nanograms per mil in a blood test.
That's what I use.
Okay. It's very easy for guys, and some people just go overboard with it, and we're pushing at 70, 80, 90. I think 40 to 60 is a better range. So that's low hanging fruit. Other things that low hanging fruit, green tea. We've talked about green tea before. It's really not, some people love it, some people hate it. If you don't love it, this is a context in which supplemental green tea can be helpful. You have to make sure you take it with food. That sort of decreases the risk that it might be stressful on your liver or something like that. But a little green tea extract as a supplement can be helpful. I'm mostly just thinking of functional foods at this point.
What about curcumin for inflammation?
So curcumin is excellent for inflammation. Most people don't realize that curcumin is not well absorbed. You can add things like black pepper to help absorb it, fatty foods. There are newer versions like the Longvita curcumin we use, which is lipid soluble. It's the only one that really crosses the blood-brain barrier and gets a much higher concentration at much lower doses. So there are new things coming down the pike on helping us to absorb some of these supplements.
Yeah.
I think from a supplemental standpoint, one of the things that you can also consider is stress. So we kind of talked about, maybe touched on this briefly earlier in terms of lifestyle, but what we do know is that stress can result in changes in hormone levels that are not actually optimum for testosterone levels. Like you can get elevated cortisol, you can get elevated epinephrine and norepinephrine. Those things kind of have a downward pressure on testosterone, or at least are disruptive to testosterone production. And so from a supplemental standpoint, if you happen to be in a position in your life where you're very stressed out and you don't have full control over changing those external circumstances to maybe lower the stress in your life, in addition to doing the things like breathing exercises and all those other things that can lower your stress levels, you can look to a class of botanicals that are traditionally referred to as adaptogens. So these are herbs that literally help your body adapt to the negative input of stress. There's a plethora of them that are on the market. One of my personal favorites is an herb called Schisandra. Schisandra has a lot of different benefits. It is adaptogenic. It's antioxidant. It has some liver support activity. I think there's some studies to show that it really helps with mental clarity and focus. So it's kind of one of those things that you can take it for stress, but it will have side benefits instead of side effects or bad effects, So you can look to this sort of group of botanicals called adaptogens to maybe help modulate your body's response to stress.
I think that's what's so important for cancer survivors specifically when you're looking at supplements, whether you're looking at online companies or Amazon or in your, daily pharmacy. It's so important that you're looking at what is in these blends. And some of these proprietary blends are not entirely transparent and you don't know if the dose is safe for you. Do you want to speak a little bit more to that?
So most are non-transparent.
Yeah.
So the reason for proprietary blend is because you can't patent supplements. If you tell someone exactly what's in your product, someone else can come and change very little and make the same product.
Right.
So most of these companies will take 20 ingredients and then say it's a proprietary blend. The problem with that is you can have 3,000% of RDA of one and 10% of an RDA in another. And so most of the times they'll do the 10% on the most expensive product
Right.
and the cheap product really high doses, and then give you a number for the entire blend. So when we formulated, we wanted everyone to know exactly what we were using. So we've given the dosage on everything in our blends. We didn't do anything proprietary. You know, someone could copy us, but I don't think they can do the same thing we're doing. But
Right.
we decided not to hide what's in our blends.
Right. And that's, what's important, for cancer survivors is they want to feel that trust, that they're getting a product that is not only, beneficial for their health post-treatment, but they know it is safe. It has that transparency into the ingredients. So I know I'm getting this ingredient at this dosage. I can take this to my oncologist and talk to him about it. It's just those multi-supplement routines that, we make here at SurvivorRx. We want that transparency with our clients because we want to have that trust. Thank you for listening to Survivorship Simplified on Air. This was part 1 of a 2-part episode. Be sure to come back next week for part 2 while we finish up this important discussion around men's health during Movember.